Hello and welcome. Let's talk about fracture of the shaft of the femur. This is a picture showing fracture of the shaft of the femur. It may be oblique, it may be communicated or anything. Classification of the fracture occurring at the shaft of the femur. Transverse fracture, oblique and spiral fracture, jet fracture and comminuted fracture. Clinical fractures. Symptoms include history of severe violence, severe pain, rapid swelling and loss of function and deformity. Signs include gross swelling of the thigh, tenderness, raised local temperature, abnormal mobility, bony crepitation, shortening of the limb, and deformity includes limb is externally rotated, some flexion of the hip and knee. Investigation. X-ray of the femur including hip joint showing fracture shaft of the femur. In the X-ray here, there is fracture, total fracture of the shaft of the femur. Now treatment. In case of the displaced fracture, supportive treatment includes treatment of the shock, analgesic, intravenous fluid and antibiotic, and skeletal traction provided by the instruments pin through upper end of the tibia near the tibial tuberosity 2 cm below and behind. Specific treatment includes open reduction and internal fixation with intramedullary nail. If lesser than 18 months or very young case, then gallows tractions will be done. If older children, Thomas splint and skin tractions will be done. In case of undisplaced fracture, adult case, skeletal traction for 4 to 6 weeks, followed by hip spica and immobilization by long leg plaster for 8 weeks. In case of children, surface traction followed by hip spica should be done. Complications. Immediate complications include simultaneous dislocation of hip, injury to major artery, injury to nerve, severe hemorrhage and shock. Late complications include infection, delayed union, malunion and non-union, as well as stiffness of the knee. End of the topic.